What is up, you guys? My name is Austin Marks and welcome back to my YouTube channel. So for those of you who don't know me, I'm currently a respiratory therapist who is pursuing the PA profession. So I make videos talking about respiratory therapy, the schooling, the boards, things like that. And I'm also documenting my journey in becoming a physician assistant. So I'm going to be making videos about the GRE, how I studied, how I did, my shadow experience, my patient care experience, and then once I actually get into school, I'm going to be documenting that. And then once I become a physician assistant, I'm going to be documenting that as well. So if you guys want to see all that, make sure you subscribe. So today's video is going to be basically a recap of what it's been like working as a respiratory therapist. I'm going to go over everything that I've done in the first 6 months. I'm going to talk about things such as how I transitioned to the workforce, what my orientation was like, just some different experience I had, what I learned in school that helped me, and then what I didn't learn in school that I had to learn on the job. So my program was great. I thought it prepared me very well. When I was applying for places, I picked the one who fit my needs the best. My orientation was about a month long, so this is a little shorter than usual. However, I learned pretty quickly and I picked up on things pretty fast, I thought. So my first 2 weeks I was on day shift, kind of just learning the hospital, how they did things. My first 2 days were basically just death by PowerPoint. I gradually did little assignments here and there, so like I started out doing a NEB, an ISB, and then I had a list of things that I had to complete, so then I eventually did things such as extubations, ABGs, assist with intubations. I was there for code, rapid response, traumas, things of that sort. I just had to basically check everything off my list before they would fully let me be on my own. So, like I said, I was on day shift for about 2 weeks, and then I am a evening/night shift employee, so then they transitioned me over to evening/night, and I was on that orientation for about 2 weeks, and then they finally started letting me do things on my own towards the end of the 4th week. And throughout the whole process, they kept asking me if I was comfortable, if I felt okay doing the procedures or the therapies that I was doing by myself. They just wanted to make sure that I was going to be adequate and that I knew what I was doing and I wasn't going to harm anyone. I think one of the biggest challenges when starting off my new job was getting the computer system down, because that's a whole new system you know nothing about. So through orientation, they wanted to make sure that I saw everything, like I was saying. When I first started out on my own, they kind of let me go to the floors at first, and then they gradually put me in the ER and the ICU right away. So that was nice because I definitely got some hands-on experience. However, if I ever had a question, I could just call my lead and she would come up and show me, or she'd tell me over the phone on how to do it. The nurses were very helpful. Everyone else that I work with is very helpful. They would help me if I had any questions. Like I said, I think the hardest thing was the computer system, as well as just being confident in myself. Like, I knew how to do these things, but to actually do them on my own. When I was in school, we always had a clinical instructor like right beside us. So to actually extubate someone or intubate someone with the doctors at a very fast pace right there, and I was the only one, so I only counted on myself. That was a little intense, but I learned to be comfortable in uncomfortable positions. Actually, transitioning into the workforce wasn't that difficult. So I do 40 hours a week. Some people will do 312s, some will do 216s and an 8. I mean, it varies based on your hospital, based on the protocols. Some hospitals will work with you a lot more and allow you to kind of pick your schedule. Others will work as a template, such as mine. So one of the biggest challenges I had was working the night shift, because for the past 2.5 years I was up from 7 a.m. to about 10:30, 11 o'clock at night. And then switching over to being up all night was a bit challenging. It took a few weeks, a few energy drinks and all that. So the things that I learned in my program, they taught me probably 80% of the stuff that I use. They taught me some stuff that I don't use. I pretty much use all of it on a daily basis. One thing that your school won't provide for you is experience. So this is just something that comes in time. So I'm still a little nervous in the NICU. I mean, I'm okay with hooking babies up with stuff, but I just a little nervous. Also, traumas, I didn't want to do my first trauma right away. I kind of waited and scoped it out a little bit, and then my very first one, I had my preceptor right beside me. That way, if they needed me, or that way if I needed them, they would be there. So my first trauma patient was a guy who shot himself in the head. he didn't do enough damage to his upper airway so we could still intubate him. I actually knew what I was doing when the trauma came in, because you gotta work fast, because usually if someone's getting intubated, it's pretty serious. Another thing that I didn't do too much in school was transportations. So in the hospital, if you have a patient that's in the ICU or they're coming down the emergency department and they're on a ventilator, and you gotta, even a BiPAP, and you gotta take them to CT scan, MRI, you gotta hook them up to a transport vent and then bring them. So I learned about MRI vents in school. However, I actually never touched one. It was pretty simple. So like I said, the people I work with, my lead, they showed me how to do all that. Some other things that I had to do on the job that school didn't teach me was different pumps. So like we ran Flowland this past week. That was something new. That was something I've never done before. I haven't ran nitric oxide. I've done it through a simulator through the school. I know what it is. I know how to use it. However, I've never actually used it in the clinical setting. So I've seen ECMO. Obviously, you're not going to do this in school. This is pretty extreme. Another thing was something called an esophageal balloon, which helps measure the intra-aortic pressure, helps give you the optimal PEEP. That was something very new. There are studies coming out on that. Just new things. Medicine is always evolving, it's always progressing, it's always moving forward. So you're always going to be learning and you're always going to be doing new things. So pharmacology was probably my worst class. I got a B in it. But it definitely clicks once you're in the clinical setting. So once you actually see these drugs get used, you're like, oh, that's how it works. I mean, I memorized the dosing, I memorized the contraindications, the indications, how it interacts with different drugs. But once you actually get out there and you see what patients you're using the drug on, you understand how it works. So when I get an asthma patient, I know exactly that they need albuterol, Duaneb, probably a steroid like Solumedrol through the IV pump. These are all things I learned in school. However, once I actually put it into practice, I got a better understanding of how it works. So that's the good part, some of my experiences. I've been all over the hospital, like I said. I worked the floors, the emergency department, the cardiovascular intensive care unit. We have an adult IC care unit. We have a progressive care unit, which is basically a step-down unit from the ICU. We have a NICU. So my favorite place to work is everywhere but the floors and in the NICU. The NICU, my knowledge isn't the greatest on it. I love the emergency department. I love not knowing what's going to come in. I love trauma. I love just the craziness that comes with it, seeing amazing things. I love the ICU. I just enjoyed the whole critical aspect and the thinking aspect and actually thinking, okay, how am I going to get this patient better? So we had a patient like that last week in the ICU, and I don't know, it was definitely a mystery. However, I enjoy that. With the floors, it's kind of routine. I mean, I obviously gotta ask patients questions. I gotta critically think in that aspect as well. However, it's not my favorite. One thing that's nice about the floors is the people aren't always as grumpy, or they're more happy to see you when you come in. So obviously, someone's in the ICU, they're pretty critical, they're not on their best terms. It's not the greatest for them. So if I go into a floor, I can smile, laugh, and I can just have a good time with some of my patients. I obviously smile, laugh, and try and cheer up my patients in the ICU as well, but sometimes they don't want to have any of it. I think even with 6 months of experience, I've definitely learned to think on my feet a lot more. I learned to just go with the flow. So a patient comes to the emergency department and I see they have a bad ABG, I see they're having terrible respirations, their ventilation problems, oxygenation problems. I know what to do. So either grab the BiPAP or I'll grab a specific oxygen device such as an oxidizer, an armor breather mask, maybe a sniffle mask. Maybe I'll put them on a high flow. I have a routine. I can see a patient, I can look at their labs, and I know what to do. This is another thing that definitely comes with experience. I mean, I can read about patients all day long in a textbook. However, I don't actually have a full understanding until I see them. Overall, my first 6 months have been fantastic. I love what I do, and I believe that is preparing me for PA school very well. So if you guys enjoyed this video and you want to see more content like this, make sure you like and subscribe, and I'll see you in the next one. believe that is preparing me for PA school very well. So if you guys enjoyed this video and you want to see more content like this, make sure you like and subscribe, and I'll see you in the next one.